Hi, Dr. Raj here, and I want to talk about the new diagnostic criteria for type 1 narcolepsy, which is narcolepsy with cataplexy. So, of course, we use the ICSD-3, the International Classifications of Sleep Disorders, Edition 3, but they came up with something called the TR. What does that stand for? Text Revision. So, if you want to diagnose type 1 narcolepsy, let's take a step back. Of course, you got to have symptoms. What is the most mandatory symptom? Excessive daytime sleepiness. For how long? At least 3 months. And of course, you got to have what? Cataplexy. That is so important because it's type 1 narcolepsy. And what is cataplexy? The loss of muscle tone when exposed to intense emotions like laughter and crying. And of course, sometimes it's hard to spot out cataplexy. It could be partial cataplexy. It only could be in the hand. It could be in the face, especially in what? Pediatrics. But we're talking about adults today. So if you want to make the diagnosis, on one side, what can you do? You could perform a lumbar puncture, checking for hypocretin levels. Of course, they're going to be very, very low. And the other side, you could do objective testing. And of course, I'm going to talk about the multiple sleep latency test, the MSLT. So how do we do that? Well, it starts off by 2 weeks before. You definitely want to do a sleep log or diary, or my favorite thing, actigraphy, just to make sure you're in the right zone, your circadian rhythm's in line, you're getting enough sleep for 2 weeks. And of course, even before that, you want to look at your medication list. There's certain drugs that may prevent you from getting REM sleep, certain antidepressants, you want to hold the stimulants, so all those is taking place. So right before you do the study, you're going to have a drug screen, so don't do drugs. And then, of course, we start off with an did I say MSLT? I meant we start off with a PSG, a polysomnography. Why? It's because you got to rule out obstructive sleep apnea. Why? You got to rule out periodic limb movement disorder. You got to rule out other things that will make you sleepy in a day and make sure you get at least 6 hours of sleep. If it's unremarkable, then we proceed with the MSLT, which is a napping study. You're going to get 5 opportunities to sleep. You're going to, each time when it starts, you're going to get 20 minutes to fall asleep. If you do fall asleep, you get an extra 15 minutes to fall into REM sleep. And what is the memorized criteria? Your mean sleep onset latency has to be less than or equal to 8 minutes. And you got to have at least 2 sleep onset REM periods. And what is the big change with the text revision of the ICSD-3 is that if you do the polysomnography and you have 1 sleep onset REM period in the setting of cataplexy, that is diagnostic of type 1 narcolepsy. So what is the take-home message? Is that the correlation between sleep onset REM periods and cataplexy is very strong. I would know the new diagnostic criteria based on the text revision for type 1 narcolepsy, and that is my high yield pearl for today.